Hi guys, let's talk about immediate actions you must take whenever you're exposed to unplanned, unprotected knacking. This can happen to anybody, okay? This happens whenever you knack without protection, you knack without contraceptives, you knack without, your cap, or your cap slipped off, or your cap got broken. Or in the case of rape, anything can cause exposure to unprotected. So, talking about immediate actions you must take after exposure to knacking or unprotected knacking. One is that you must protect yourself against urinary tract infection. You must protect yourself against STDs, sexually transmitted infection. You need to protect yourself if you're a lady against unwanted pregnancy. How do you do it? Run to the bathroom and urinate. The first thing you have to do is to urinate. Urinating will flush down bacteria from your bladder. All these bacteria trying to ascend to your bladder to cause UTI. Flush them out by urinating. If it's possible, stay in the toilet seat for a small period just to push down whatever that is in there. Don't dodge. Don't put any chemicals in your vagina or in your anus for any reason. For washing, don't try it. If you try and douche at that time, you are increasing chances of infection. You are trying to push the infection further inside. Don't douche at all. Next thing you have to do is to run to any close-by pharmacist. Ask them for Prostanon 2 if you're a lady. Take emergency contraceptives. Prostanon 2, or what we call Plan B, is very effective for such exposure. Okay, Prostanon 2 works very well within 3 days of exposure. You must take it within 72 hours of exposure. The more hours increases, the potency drop. So the more hours increases, the power of Prostanon 2 reduces. So you should take it as soon as possible. Just run to the pharmacy, get it. You can get it over the counter, right? Then, if you are not able to get this Prostanon 2 within 3 days, you can go for IUD, intrauterine contraceptive device. IUD is very, very effective. I think it has about 99% effectiveness. It's very effective. IUD within 5 days is very, very effective as well. Okay. Then another thing that will strike your mind is concerning STDs. Run to the hospital, ask for post-exposure prophylaxis. We nurses, we also take it. Whenever we get exposed to injections or to sharps, we take post-exposure prophylaxis. If you're not very sure of the patient status, ask them. You got exposed to unprotected sex and you are not sure of this person's HIV status. They will give you a course of post-exposure prophylaxis. It's very effective, okay, against HIV. All right. Then you have to watch out for signs of STDs, signs of gonorrhea, signs of chlamydia, signs of vaginal wasp, signs of yeast. All this infection has their distinct symptoms. You have to watch out for these symptoms like itching vulva. You have soreness around your genital area, including itching, soreness, pain during urination. Boils everywhere, sore everywhere, or painful urination. You might have pus coming out whenever you are urinating. All these are symptoms of STDs. Whenever you see this symptom, burning sensation, run to your doctor for some treatment. Right? So in this case, you have to go to your doctor for proper treatment. These are the things you must do. You must do it as fast as possible to protect yourself against STDs, against pregnancy, against urinary tract infection whenever you got exposed to unprotected knacking.